This section is about fire safety in a child care provider's home. The home shall have a written plan for emergency evacuations. There shall be a drawing of the primary and secondary exits from the house and meeting places for the children once they've exited. The home shall conduct monthly fire drills and maintain a written record of when they were conducted. A meeting place that you select should be a safe place away from the home that will definitely be there. It should not be a car or seasonal flowers. As you can see in this example, the meeting place is a tree. The fire escape plan must be posted in your home, and fire drill records may be maintained in any manner that you wish. Some people keep a written list. Others keep their calendars for the year to show when they were scheduled. However, you wish to keep this record is fine as long as you're able to provide it to your regulatory specialist during an inspection. The evacuation plan that you develop shall be developed and updated annually. A copy shall be provided to the child care regulatory specialist and a parent and guardian upon request. Keep a copy of your evacuation plan. You'll be sent 2 blank copies so you can complete one to give to your regulatory specialist and keep one for your records. Be sure to provide the parents and your regulatory specialist with an updated plan if you make any changes. Remember, the emergency plan must be posted in the home. Include 2 designated relocation sites, a procedure for notifying parents, and coordinate with local emergency management officials. A designated relocation site needs to be a site that you will take the children to if you need to evacuate the children from your home. You should think about what is in your area that you could take your children to. One site may be close by, and the other could be a site that is a little farther away. Make sure you discuss the relocation site with the owner of the relocation site to ensure that it is okay to bring children there. A working smoke detector should be installed on every level of the home. They must use working batteries or be hardwired. Basements and finished attics are included. A good rule of thumb is to change the batteries at daylight savings time. Digital carbon monoxide detectors shall be installed in all residents that use gas, propane, wood, or pellet burning stoves or appliances. You must have the digital carbon monoxide detector unless your home is all electric and has no wood burning or pellet burning stoves. A carbon monoxide detector needs to be installed close to the floor. Working batteries should be installed in all times in both carbon monoxide detectors. An ABC-rated multi-purpose fire extinguisher shall also be available at all times. Check your fire extinguisher for the 3 boxes, A, B, and C. The fire extinguisher needs to be easily available in the home, but stored out of children's reach. Must be fully charged, and a good idea is to check the charge when you do fire drills to ensure the extinguisher is still fully charged. Heating devices that require ventilation shall be vented to the outside. Unvented heaters may be used as a supplemental source of heat when a properly functioning digital carbon monoxide detector has been installed, and the heater is equipped with an oxygen depletion sensor. Heaters need protective barriers or to be inaccessible to children by placing them higher on the wall. Non-flammable protective barriers shall be installed around wood-burning stoves, open fireplaces, and unvented heaters. This barrier shall not be hot to the touch. Electric space heaters are allowed if they are UL approved and stable. Heaters which are not stable or get hot to the touch must be inaccessible to children. Kerosene heating stoves are prohibited while children are in care. It's best if electric heaters that you use have the tip-over, turn-off feature. Please check with your regulatory specialist if you have questions about a specific heater. Heating equipment and hot water tanks shall be clear of combustible materials. Hot water tanks shall be equipped with a pressure relief valve and inaccessible to children. If you live in a manufactured home and your water heater is in the wall, please make sure the access panel is readily accessible at the time of your initial visit and for yearly reviews of your regulatory specialist. Please have the panel removed and ready for inspection. If the hot water heater is in a closet, this closet is strictly for the hot water heater and should not contain other storage items. Air conditioning or fans that are adequately shielded or out of children's reach shall be used when temperatures exceed 80 degrees. This is 80 degrees outside temperature. The environmental safety of a home. Parents shall be notified in advance if anyone in the home smokes, uses other tobacco products, or e-cigarettes. A caregiver shall provide a smoke-free environment. Smoking is prohibited while children are in vehicles, and tobacco products, ashtrays, cigarette butts, lighters, matches must be kept out of children's reach. E-cigarettes and other nicotine products such as gum or patches shall also be kept out of children's reach. Caregivers must keep documentation on site of rabies vaccinations for all dogs and cats on the premises. The vaccinations are for all cats and dogs regardless of whether they're kept inside or outside. Ferrets will need vaccinations as well. Confine sick, aggressive, or injured animals away from children. And keep in mind that certain breeds of dogs are considered dangerous or aggressive. Litter boxes are kept out of areas used by children. A pet acknowledgement form completed by the caregiver and signed by the parents must be on file. The pet acknowledgement form must be updated as pets are added or are no longer in your home. Keep pets such as ferrets, reptiles, birds, or wild animals in an area or cage that is not accessible to children. Area around the cage must be clean and appropriate. Washable floor coverings should be used under these cages. If pets are kept in areas used by children, the cages must be small wire or mesh that prevent children from putting their fingers through the cage. If a child is bitten by an animal and the skin is broken, the caregiver shall notify parents immediately and notify the DHHR regulatory specialist within 24 hours. A written report of the incident also needs to be given to the parents. An official incident report must be sent to West Virginia DHHR if the child seeks medical treatment. The outdoor play area must be available clean and free from unsanitary materials or other hazardous items. Outdoor play equipment shall be safe, in good repair, and free of sharp edges or any protruding parts. The equipment shall not be placed over or immediately adjacent to any hard surfaces which might impact the safety. Think about your fall zones from play equipment to ensure children do not fall hard on surfaces or other play items that may affect their safety. If the regulatory specialist has a cause for concern, they can require the fencing. An example could be if you live next to a major highway, a body of water, or maybe railroad tracks. Please note that trampolines shall not be accessible to the children in care. If you have a trampoline, it must be surrounded by a locking net, and even with the net, the children are not permitted to use a trampoline in care. Now we will talk about the health, sanitation, and nutrition of the children in your care. When a child arrives to your home, please observe any signs of illness or injury. Report any accidents, illnesses, or exposure to communicable diseases to the parents and isolate a sick child from other children. Obtain written permission to administer any medication with a schedule of times and dosage provided by the parents. All medications need to be in the original container, and make sure the prescription is for that child only. Also make sure the prescription was recently filled. Check the expiration dates of all medications. Just contact the parents if there are any concerns or issues that prevent you from being able to give the medication. Think about your sick policy. When children are too sick to come to child care, and discuss this with the parents. You are not required to provide sick care, and you are not required to give any medication. Medical exams and immunizations are required for all children under 6, and medical exams shall be updated once every 2 years. You as the caregiver shall obtain these examination forms within 30 days of a child's admission to your home. The child physical form must be signed by an appropriate medical person. Unlike your caregiver form, if the child has been to any doctor in the last 6 months, this form can be taken to that doctor and request it to be completed. Child physicals must either be on the child physical form the DHHR sends you or on the West Virginia Health Check form. No other form will be accepted. Immunization records can be attached to the physical form. Child physical forms will be included on your second packet. Caregivers and children shall thoroughly wash your hands with soap and water for at least 20 seconds anytime they're soiled. This includes before eating, handling, or preparing food, after contact with animals, before and after diaper changing, after personal bathroom use, when in contact with blood or other bodily fluids, and after outdoor play. Children and visitors should also wash their hands upon arrival. A caregiver needs to help small children and infants with the hand washing process. Caregivers shall ensure that clean drinking water is available. Well water must be tested or provide bottled water for drinking. A caregiver must also employ universal precautions. Store food and drink in closed containers and refrigerate if needed. Cover garbage can with lids, maintain with liners, and empty them daily. Only your main garbage can, where household waste such as food and diapers are placed, need to have a lid. A caregiver must clean dishes in a dishwasher or wash with hot water and detergent. If dishes are washed by hand, they must be allowed to air dry. You must also ensure that the home is free of rodent and insect infestation. Ensure that doors and windows that are left open have screens. As part of being a child care provider, it is important that children receive nutritious meals and snacks to meet their needs. Children are encouraged to eat, but are not forced to eat. You do not use food as a reward or a punishment. Children should be seated comfortably at a table or high chair during meals or snacks. If you do not have a dining room table, a child-sized table and chairs are appropriate. Be sure to sit with children during the meals and snacks. Children should not be sitting on the floor to eat. Information on the child food program will be included in the packet of information that will be mailed to you. This program will reimburse you for the food that you serve to the children that are in your care.